It's Monday, July 7th. I'm Adam Walsh, and this is The Signal. Today on the show, the provincial government says we are a well-being province. What does that mean exactly, and how can it help improve health outcomes? I've got some of the folks doing the work around this right here in the studio. Don't go anywhere. So the jumping off point for today's show, I was following these community well-being fairs that were taking place, and I was watching them happen, and I was curious about how they were received, how they fit in with the well-being work that's being done, and I was curious about the big picture, the health accord, social determinants of health, looking down the road to making this place a healthier Newfoundland and Labrador, right? Because the aim for the provincial government is to have Newfoundland and Labrador become the healthiest province by 2031. So today we're going to talk about that well-being side of health and why it is important and what the work that's being done, where it's bringing things. So joining me here in the studio, we've got three folks. We're going to call a couple people. We've got someone on the line, and you're going to learn all about some of the work that is being done. We've got Lindsey Hynes here, Director of Community Vitality, Innovation, and Impact with the Community Sector Council. How are you doing?
Good.
So yeah, you're the one. You're the reason.
Oh, I don't know about that.
Thanks for coming in.
Thanks for having us.
And we've got Dr. Pat Parfrey, CEO of Newfoundland and Labrador Health Services. Sir, how you doing?
Good, thank you, Adam. Thanks for having us.
Thanks for coming back on the show. Lynn Taylor is here, Assistant Deputy Minister, Wellbeing Cabinet Secretariat. How you doing?
Great, Adam. Thanks for having us.
And on the line, Darla King, Vice President Transformation at NL Health Services. Hi, Darla.
Hi, Adam. Great to be here.
All right. So, I mean, essentially, full house as far as seats go. Where do we jump off with this? Like, when I say well-being, what the heck do I mean? What do you, or actually, what do you mean? Because who cares what I mean? Who wants to go first?
I can probably jump in on
Sure.
that. So, I mean, really, well-being is a direct response from the Health Accord's call to action around improving awareness, education around the social determinants of health. So things like income, education, food security, social inclusion, all of these things that shape health outcomes. Of course, well-being is a little bit less of a mouthful than social determinants of health, so it's a little bit of an easier thing for people to maybe wrap their minds around or have an appreciation of when it comes to, what does it mean for me as an individual, what does it mean for me as a community, and what does it mean for us as a province?
Yeah, if you think about yourself and what you need to feel healthy, then it's like, well, I've got a roof over my head, I'm eating some healthy food, I'm getting some exercise here, I feel part of my community, I'm not isolated and lonely. Like, all these things start to stack up and kind of intersect with each other. And then if you're good with all of that, maybe your health outcomes will be better too, right? Is that kind of part of it?
Absolutely. So the Health Accord was really fundamental in saying that if we're to improve health outcomes in the province, that we needed to work on, obviously, things that are happening within the healthcare system.
Yep.
So nobody's ever going to sit here today and say that access to family medicine or the care or services that you need with respect to healthcare is not important. It absolutely is. But the other whole half of the Health Accord was around social determinants of health and the things that are preventative in nature and that we might be able to get ahead of upstream to prevent the need for healthcare as we age and, as we go through different places and spaces in our lives.
So Dr. Parfrey, what's the jumping off point for us? When you're coming into this, and we've done shows on the Health Accord, you've been my guest before, as you put everything together for it, and you're looking at the jumping off point for the health of Newfoundland and Labrador, where are we starting from here, or where are we on the continuum of things moving forward?
Right. I think that we have to realise that our health is much more than physical health, blood pressures and sugars and weight and all that stuff.
Yeah.
But it's about mental health and social health and environmental health and financial health. And I think that if we're really trying to prevent the things that kill us or come to our healthcare system, the big ones are cardiovascular disease and stroke and cancer care. And the biggest determinants of those outcomes, which are the ones that kill us, relate to our personal responsibility for how we live and how healthily we live. And in particular, the social factors that influence those things that allow those diseases to develop. So clearly, if we're thinking in an upstream way, as Lynn is talking about, and talking about improving health by 2031, action on those things are really important.
How much work, folks, do we think is needed to get there by 2031, given the history of health and well-being for Newfoundland and Labrador?
Well, I think that the changes that are necessary are going to take decades, not 5, 6, 7, 8 years. So the idea that if we're talking about personal responsibility for our health, that we don't smoke, that we exercise, that we eat healthy food, drink less alcohol, those things are our own personal responsibility. But the idea is then that we have to be able to improve poverty, particularly childhood poverty, food insecurity, a better educational system, inclusion, to be able to improve inclusion of excluded people. Those types of things require not only policy by governments, but they also require action by the communities in which people live. Mm-hmm. And that's the piece that we're really, really interested in, is to try and influence communities to be able to improve the social factors within their community to improve outcomes.
Yeah, because we're in a time of trying to change so many different layers, right? Like it's just so much work. It's like changing a health system, breaking down silos, but also changing the understanding, the individual understanding and responsibility around how we go about living the day-to-day to be healthy.
So I suppose that our hypothesis is that the structure of Newfoundland communities is our superpower, whereby Newfoundland communities stress the connections between people. They stress the fact that that we know that life satisfaction with these communities is high. So the hypothesis that we've got is can we use the strengths of those communities to take action on the social factors that influence health within their own communities, and that particular way of doing things would allow us to advance faster than what we would do if we're just depending on individuals.
The sense of the sense of belonging, I should say.
Correct.
Newfoundland and Labrador, and how strong it is. Darla, let me bring you into this. Vice President Transformation at NL Health Services. Talk to us just a little bit about your role, and then we'll go over to Lindsey about the fairs.
Yeah, sure. Thanks, Adam. I guess, my role at NLHS is really focused on that second call to action from the Health Accord that Lynn talked about earlier. At NLHS, we obviously provide excellent health services, and we're going to continue to do that. But we also recognize we have a role in this social determinants of health piece as well. We can be leaders in this area. We've got people who, know this policy and how this should work. And we've got a lot of influence over people, throughout the province. So my role is to really look for those opportunities and try and strengthen them. We already have a provincial public health program, and those will be some of the folks who understand this work. We've been doing it for a long time. There's actually legislation that calls for us to do things like promote health and well-being, protect the communities from health risks, provide healthy environment, and improve the health of the population. So, those providers sort of understand how to work with communities and, try and engage and bring about some of these changes in the social determinants of health. However, we also know that, many of our providers are really used to focusing in that medical model, really disease prevention and disease treatment. So we're also trying to infuse, in those providers, knowledge around the social determinants of health, and to look at how we can all take a role sort of with individual patients or groups that we might be involved with. So that's some of the pieces that I've been involved with.
Excellent. All right, then when we talk about these community well-being fairs, where'd the idea come from, and how are they working? Lindsey.
Yeah, so I work at the Community Sector Council, and we've been around since 1977. We support change makers in Newfoundland and Labrador, charities, nonprofits, volunteers, paid staff. And when the Health Accord started doing some public awareness, if you look around any community in the province of Newfoundland and Labrador, your nonprofits are working frontline in the social determinants of health. So we did our first well-being fair here in St. John's at that time with over 40 booths from community organizations, and we did that ourselves. And so from that, we have this wonderful partnership between some major systems, and these have been going across the province. We've been in 5 different regions in the last year, so that's with the Community Sector Council, Wellbeing NL, the Healthcare Foundation has provided some funding, and the Cardiovascular and Stroke Provincial Program focusing around prevention in our province. And we have engaged people who live in the area to create these, and also the organizations that are there to make sure that these events are accessible and community. We really focus on there's a lot of ways to look at it. So the organizations themselves are really starting to embrace the language of the social determinants of health and be able to tell how they show up in the social determinant space and well-being. And then the community members, when they come in, oftentimes we think there's nothing in our community. If we don't have access to a family doctor, then we probably don't have any services. But in actual fact, if you look around the Lions Club, the SPCA, the Murphy Center, a lot of organizations have provincial departments across our province now or offer services provincially. So we actually have quite a lot of support in the social determinants of health, and these fairs are really opening up that transfer of information.
Yeah, so it's not stuff that yes, we can have the discussion about a family doctor and everything else, but there's stuff in communities that you're discovering for conversations. Dr. Parfrey, go ahead.
So part of the fairs and probably what initiated is a thing that we call an event that we call a time for health. Yeah. And a time is a pun on a good time, or it's about time. And a group of us tried to put together a way of being able to deliver messages around healthy living and social factors that influence health in a way that was non-directive. And that also helped us with this idea that community is our superpower. And the way we created Time for Health was we stress culture. At the beginning, we've had Indigenous drumming and singing, and then we have a part of it is a patient speaking to a cardiologist about their events and how they lived, etc. And then there's a discussion around social factors that influence health, and then there's a chef speaks about food, local food, and nutritious food. And all of that is interspersed with songs between each section by a local group of people that, again, stresses the cultural component of it. So we're trying to come up with some way of being able to deliver messages about our health and our social factors that influence health without being seen to be directive or blaming people, etc.
And why is that so important, not being non-directive?
Because I think people reject being told that they're doing something bad.
Yeah.
So if you don't exercise, people don't like being told you must exercise. Whereas if they come to the conclusion themselves that exercising is a good thing, and they're going to change their life so that they actually have more exercise, or if they change their life to eating less so that they become less obese, etc. They're kind of personal things that we try to put into effect. People say, this stuff, you're not going to get much action in this stuff. In Newfoundland, people are not going to change very much. But I'd like to tell you that 20 years ago, 25% of Newfoundlanders were smokers, and now it's 12%. So there has been a big change.
That's quite the change. And what kind of an impact do you think that has had on the health system then?
Well, smoking is the biggest predictor of things like cancer and cardiovascular and stroke disease. So it certainly had an impact. But it just gets balanced by other risk factors. Yeah. So it gets balanced by the fact that we become heavier and we are less active. And then the key piece, of course, is that people who are disadvantaged are the people who don't eat as well. If they're poor, you buy cheaper foods that are processed foods that lead to deterioration in your health. So it is complicated, but the messaging around personal responsibility for healthy living and action on the social factors that influence health is important. And that influence on social factors is more than just us. It's more than just the governments. It's not the federal government's responsibility or the provincial government's responsibility. It's all of our responsibilities, particularly influencing the communities in which we live.
So, folks, for all of you, what's it like at this point in time to be doing this work? To be on a mission to get the message across about well-being in a way that where you're in community, listening to community, and not directing. and in a time when we're trying to change the whole health system.
You go first. I'll go second.
I'll go first.
These are every so often I pepper in personal questions because I'm always curious about the nuts and the bolts of people and why they're doing the work.
Sure. Well, I think from my perspective, I mean, working within government, you're hearing a lot more conversations and a lot more connecting the dots of the work that is already happening, but maybe has not been connected in different ways over the years. So you're seeing a lot of that happening, and more every day. But I think the thing that I'm seeing and so happy about is the engagement of the community sector, the engagement of municipalities, and everybody is kind of seeing this as something that they can have a role in and should have a role in. And I mean, communities and towns and municipalities have been doing this type of work for years. So it's so great to get out in community and learn from what we know is already working, and we just need to do more of.
Darla, what about yourself on the line?
Yeah, I'd certainly echo Lynn's thoughts, but the other piece is we're learning as well as we go out to these communities. Each community is different. They've each got their own strengths and their own challenges, and sometimes, we've seen, the same thing as a weakness in one community ends up being a strength in the other. So it's not only learning for the communities, but it's learning for us, right? When we see things like, the meal delivery service that they're doing in the Placentia area, or the community gardens that they're doing in Southern Labrador, it's all excellent examples. So, we all have a piece to play, but we also can learn from each other.
And if I could, so when we go out into the community, you have to go there to know there. I really operate my work at the Community Sector Council that way. And we hear often all the time, I can't believe all these people are coming to our community. So there's a deep appreciation for folks making the journey to go. So we have been all the way to Cartwright and back. And also they're being heard. They feel heard and seen. So we have had, ample conversations between all of the stakeholders in communities, and they tell them what's the issue in the community, or what is the strengths, as Darla said. I mean, we went to Placentia and we used the Star of the Sea as a venue, which is a nonprofit around for 150 years. And the ladies auxiliary there cooked our meal. Just mostly two main volunteers prepared the food. And not only did they prepare lovely food, they had a hook on fresh moose, moose that we could get in the community to really use that locally available produce to celebrate our cultural foods. So, and folks are really saying, I didn't know there was things in my community. I didn't know this resource existed. So we do some data collection, and the majority of folks, over 90%, consistently in every event have said, I have learned about a new program or service for me or someone else in my life today by attending these events. Yeah. So the resources are there. Somehow the information isn't getting, dispersed that these exist. So folks are leaving, and there's often a lot of new partnerships created between the NL Health Services and the community sector organizations that attend. They've said, it's the first time I've sat in a room with so-and-so. Never, we're going to have coffee after, and we're going to figure out how we can collaborate and do cool things in our community long after the day that we're there.
It underscores the importance of communication and knowing who's doing what and where, and how to kind of hook people up in and around different communities of Newfoundland and Labrador to kind of build on the good stuff that it might be something on the Northern Peninsula that could maybe work on the Burin or vice versa, or on the north coast of Labrador. Just knowing that there's folks doing it and learning from it, I mean, I can see how that could be really, really helpful.
One of the things that the Community Sector Council does quite a bit is that sharing of the capacity and making these opportunities for folks to get together. And we also do some good data collection with the people who come as booths, we'll say. And they also always learn about a new program or service that they didn't know about. So now they can refer people. And I think that ultimately will increase health outcomes for Newfoundlanders and Labradorians as well. Because if I can't provide a service to you, I can now refer you to someone else who can.
So I know that this Newfoundland and Labrador, when it came out, and former Premier Fury said we're a well-being province. It was a first for that type of a title in the country. But is this work being built off of anything else in other jurisdictions, or is this leading the way and something different here in Newfoundland and Labrador right now?
I think other jurisdictions are a bit further ahead than us, not Canadian jurisdictions, but New Zealand and Wales and Scotland, etc., have got distinct well-being policies and legislation around budgeting for well-being policies. So in Canada, across the provinces, there are bits and pieces that are actually done. But by us coming out first and saying that we are a wellbeing province means that the provincial government have stressed that their policy, they need to take a lead in the development of policies that focus on the social factors that influence health. And they've actually done so in several areas, like the childhood benefit and the breakfast and lunch school programme, and various other policies that were undertaken. The Education Accord had a similar background in terms of how educational system can influence the social factors that cause bad health outcomes.
When did this turn the corner in and around medicine or for discussion? Because, like, for yourself, how long have you been a doctor for now, Dr. Parfrey?
Far too long for anybody else to know.
So, with that, right? When did things start to change for the conversation around this, and then for you to be in, to move into a position like you're in now, to be shepherding some of this stuff?
I don't think it's rocket science. This has been around for 30 or 40 years, and the criticism in Canada is that we focused our spending on hospital services and didn't focus our endeavours on the approach that deals with healthy living and the social factors that influence health. Lalonde and the federal government had spoken about this, a long time ago. I think there is an understanding that we need to do it, but the biggest pressure on governments, provincial governments at the moment, is around healthcare delivery, and where the demands are large and will continue to be large, and the capacity for a government to say, I'm going to intervene in something that gives us better outcomes, like childhood poverty or food insecurity. And the reason that we're stressing this is that the voters pick their governments, and the governments should be responding to the voters. And we think that these types of endeavours are really, really important, and that's why we need to increase awareness, so action is actually taken.
Yeah. Darla, when you and I were getting ready for the show, we talked about health equity. I'm just wondering if you could kind of give us a bit of an explainer around why that's important and what that means.
Yeah, sure. So, health equity really just means that everyone has the same opportunity to lead a healthy life, and no one is disadvantaged by, social things or economic things, or where they live, how much money they make, all of those social determinants of health. So, we really want to achieve health equity. And if we're going to do that, we need to acknowledge that everyone doesn't start at the same place, and different things are going to be needed. So different strategies or resources to correct that imbalance, right? So, at NLHS, for example, we're trying to build some of those foundations. Some of the things we need to do is, even understand our populations better, be able to track, for example, in our health record, who is Indigenous and who is not, different income brackets, et cetera, your gender, because we know all of those things do put people at a disadvantage. Our thoughts are, if we can understand better these populations and then look at their health outcomes, we can actually then start to tailor interventions or strategies to actually reach these groups. So, it's a really important piece, because we don't want to just do everything the same way for every person. They may not need the same types of services.
And this comes down to, Lindsey, what you're saying about the community well-being fairs, right? Like, you're going and listening, because each community is different, and what you're hearing from different folks. It will depend on geography. It will depend on, different backgrounds of people and communities around the province, right?
For sure. And these events aren't cookie cutter either. So it's not just like every event is unique to the community that we visit, and they are co-created. So when I do some outreach, there's always a local community partner. For example, recently in Placentia, we had the Placentia Area Chamber of Commerce as a partner. In the Southern Labrador, we had the CYN there as a partner, and the SLDA, the Southern Labrador Development Association. And so we always have a local expertise that helps us co-create these events. We never organize for, we organize with.
Paul Thomey, Executive Director of the Eating Disorder Foundation of Newfoundland and Labrador, is on the line. Paul, you folks were at one of these events. How was it for you?
It was great, Adam, and thanks for the opportunity. We've actually been at more than one. Last summer, I guess, we participated in 2 events out in Gander and Grand Falls, and we were also at the one Lindsey just mentioned in Placentia. And for us, it's a golden opportunity. It's an opportunity to get out to communities, to do some outreach, to talk about the services we offer, listen to what people have to say, and steer them in the right direction. And to be quite honest, it's something that we would be challenged to do on our own, to be able to get out into a lot of these communities. But in the environment that Community Sector Council has set up, it's a wonderful benefit for us and something we want to continue to take advantage of.
So when you're out in these communities as executive director of the Eating Disorder Foundation of Newfoundland and Labrador, or someone else with your organization, what's some of the messaging that you're talking to folks about and that you're connecting to people with?
Well, I think that the first message that we're trying to impart is that if you're dealing with an eating disorder or you think you're dealing with an eating disorder, there is an organization available in this province that can help you, can provide you with navigation to get you into the system, or can provide you with the training and support to be able to help you on the journey of recovery from an eating disorder. And that goes for not only individuals, but for their family members and their loved ones, because a lot of the people we talk to are either health professionals who are there to see what's going on. Guidance counselors is a great example of somebody from the healthcare field and the education field who come in and say, hey, they see our booth and say, gee, we think we're dealing with some students in our school who are dealing with an eating disorder, but we're not sure where to turn. What can you provide us with? Well, we can put you in the direction of talking to a counselor. We can provide you with support information, and that always seems to work. And invariably, we've had that happen to us every time we've been out in the field at some of these sessions. We also get parents who come along and say, take our brochures and have a look. And in a lot of cases, they subsequently give us a call to find out what support and services they can get because they think they're dealing with an eating disorder but have no idea where to turn. So the avenues are multiple for us. And again, hard to do, just doing it on our own without the support of a larger organization and a larger setting where people are gathering.
So yeah, you're out, you're making first contact with some folks, whether it's guidance counselors, parents, letting them know who you are, what you're about, how you can help people. Are you also running into folks who you've been in contact with before and you filmed?
Yeah, really good point, Adam. I haven't been to a session yet where a parent or a grandparent hasn't come to me and say, we so want to thank you for the great support we've gotten from you in the past. We were dealing with an eating disorder a few years ago in our family unit, and thank God our son or our daughter is now doing really, really well, but we'd never be where we are if it hadn't been for the support we got from your foundation. And I got to tell you, that's inspiring. That's what makes you want to continue to do these things, and having this type of a forum to do it is just a great opportunity.
Paul, thanks so much for coming on the show. I appreciate your time.
Oh, you're very welcome. Thank you.
Paul Thomey there, Executive Director, Eating Disorder Foundation of Newfoundland and Labrador. Folks, any thoughts on, for you, whether running the fairs or for the two of you sitting here or on the line, what does this say to you to hear this type of a thing from the wellbeing fairs that have gone on?
Well, I'm really happy that people are obviously, that they're enjoying these events and that they're meaningful to people in community. I think that's the key thing for all of us is how do we get out there and how do we run these things in a way that is going to be meaningful and have some lasting impact and really encourage people to build momentum and carry these messages themselves. I mean, obviously, the 3 or 4 of us are only 3 or 4 people, and our voices are much less important than the people that are already out there in community doing this work every day.
Dr. Parfrey, any thoughts?
My thoughts more revolve around how do you amplify these comments, and also how do you amplify what we're talking about, because the reality is at these events we've probably had an attendance of up to 2,000 people, and we've had a virtual add-on of about 6,000 people or over 6,000 people. Well, we know the population is 540,000. We get these unintended consequences of having the media pick up our message like you're doing here and add to that amplification, and we're dependent upon people who've attended or listened to us to pass the message on. And that to us, we're not going to get change in the way we live and how healthily we live, or how we change the social factors that affect health, unless we get that amplification. And that message that that gentleman provided was inspirational, and that's amplified by 40 other groups that attend, and it's amplified by the community wellness committees that are in regions, and amplified by the clinical practice advisory committees that all have as a key objective to improve well-being within their communities. So all that, everything helps.
Communication's so important, eh? Like we're in a time when there's this fire hose of information all the time, yet the stuff you need may not be hitting you in the face from that fire hose. It might be at a fair, or it might be because someone you know knows something else, and just trying to figure out what information is good for you and your well-being in your community, Newfoundland and Labrador, what's like appropriate, can be hard to get to unless they show up at something, right, Lindsey?
And a perfect example of that is you think with Google and with social media that we can find that information really accessible. But I can speak to being on the road with Paul and him. We had some radio coverage in a region, and someone heard on the radio that the Eating Disorder Foundation was in their community and came to the event specifically to speak to him about their child. So by us being there and that radio coverage, I mean, again, if you Google things, it'll come up, but sometimes it's about the timing, it's about having that conversation in the moment. And I would anticipate a life or lives were changed by that one time and place.
So what other work then? Like as we do these, what work do we build on?
So we don't just do the wellbeing fair when we go there. Like or the Time for Health event as well. We have meetings with municipalities, and we've got meetings with schools and the educational system. And we had really interesting meetings when we were in Southern Labrador with the Development Association in Lansaloo, really doing great work there. And they were well ahead of the posse, I think, with their approach to the social factors that influence health. And on that trip, we went up to Port Hope Simpson and Cartwright and met with the Nunatuckavut representatives and got feedback about lots of things, including their health system and the social issues within their community, that were impossible to get those the understandings of those communities without having gone there, and it was really valuable. And it's a response to those people. Oh, you're wasting your time going up there. There's only 3,500 people there, but those 3,500 people have had adverse health outcomes as well. And how we actually deliver interventions to that group of people can be extrapolated to other groups of people as well.
Yeah, and someone who, they couldn't make it on the show today, something came up, but I was chatting with her last week about that Labrador trip. And to paraphrase, she said, we were really surprised that the bigwigs showed up and actually listened to us, because that hasn't really happened before. What does that say to you?
I'm assuming she thinks I'm a bigwig. Well, the reality is that we have to deliver care as NLHS services to everybody in this province. And as Darla said, equity is a key thing, is that does every person in this province have an equal opportunity of benefiting from the interventions that are available in the health system. But the new part of it is that, again, it's Darla's portfolio, is that we have a VP for Wellbeing, which revolves around how do we change society to be able to have better population health and to prevent cardiovascular disease and stroke. And the fact that we actually have that in our health system is a big thing. And the fact that we also have in government somebody in Cabinet Secretariat who's responsible for a group called Wellbeing NL, which is meant to have horizontal connections of departments to ensure that there is action on things that affect well-being. They're all big changes, and very good to see us so innovative, I suppose.
Darla, do you want to weigh in on what Dr. Parfrey was saying there?
Yeah, well, one thing I did want to comment on, Adam, was just, when you talked about the purposes of the well-being fairs and how we, what we've learned and what we plan to do next, like it really is about capacity building in these organizations. So, we're meeting with individuals, they are learning, they're improving their own capacity to make healthier choices. The partners that are there are learning about other partners. They're making connections in places where they, potentially haven't been before and extending their reach. the partners and the community members that are there are talking to each other and talking to their groups. So we're building this capacity within the communities. In some cases, it's already there, but in other cases, we're expanding on that. And, we are looking at other ways that we can bring these groups together to, support them in using that capacity as they build it. So it's not just about that one-time event. It's about using that as a foundation and then trying to build on that foundation. And really, that's sort of what we're doing in NLHS as well, right? We're building our public health program to make that stronger. We're trying to educate our own staff, using different techniques and looking at how we're collecting that kind of information. So, we're building our own capacity as an organization as well to really improve this, this type of work on the social determinants of health.
Yeah, I mean, I can see how the follow through on this is crucial, right? If you just show up and then it's like, well, that's done, fine, there can be some benefit to that. But then if you're actually staying in touch with folks and building on what you've learned and heard and having folks actually feel like they've been heard and that there's action been taken, I can see how that would be huge.
I think this is why it's so important that all of us are here and working together. So, I mean, if you think about government working together with NLHS, working together with the Community Sector Council, who can bring, together so many other different partners that we might not necessarily have a connection with in the same way that Lindsey and her folks would. This is why these types of partnerships are so important and that, they seem to be working so well for us. And I certainly hope that we'll be able to build on the momentum of it.
I'd just like to add that the things we're dealing with are not going to be dealt with by one event or one visit to various communities. These are ongoing efforts that need to continue all the time. When you come to healthcare, the demands in healthcare are enormous and they're not going to go away because people will always want healthcare. And when you come to these issues about trying to improve social factors within communities, they're not going to go away. There needs to be a constant effort to be able to try and solve these problems.
Yeah, like democracy, health takes constant work and thought. Hey, when you've been on the show before, we talked about silos. One of the issues with coming into the health court, it's like, there are silos everywhere. But now we're talking about people, right, in this room who work across departments. Dr. Parfrey, I'll ask you this question: Do you see these silos kind of coming down for where things are supposed to be headed for the health accord?
There is no doubt that the attempt to have horizontal connections between departments and even within communities, the capacity of their silos to be able to connect to ensure that there are ways of being able to access and help vulnerable people and ways of being able to help individuals make better choices is dependent on getting away from the silos. However, the silos are part of our culture and they're really hard to break down. Yeah. And if you don't keep at it, the silo comes back up again. So change management is the biggest challenge that we've got, both in the health system, healthcare delivery system and in the social system, to try and ensure that we are actually capable of breaking down these silos.
So how do we stay on top of that?
You've got to keep at it.
Just keep at it.
You've got to be persistent.
Yeah. Leadership matters.
And consistent.
Okay. Lauren Hallwell is on the line, Executive Director of Credit Counseling Services of Newfoundland and Labrador. Lauren, how you doing?
I'm good. Thanks for having me. How are you?
Good. You've been, tell me about being at one of the well-being fairs in your position or for the Credit Counseling Services of Newfoundland and Labrador for folks attached to you.
Yes, it's been such a wonderful experience to be part of the wellness fairs across the province. At Credit Counseling Services in Newfoundland and Labrador, we believe that financial wellness is a big part of overall well-being because when money is stressful, everything else can feel harder too. Finances are a huge part of our overall well-being. When money feels out of control, it affects everything: stress levels, sleep, relationships, and even physical health. So being a part of these fairs has been a powerful way to connect the dots and show people that financial wellness is part of wellness. Yeah. Even though we don't have physical offices in every town, being a part of these fairs has allowed us to connect with people all over the province. So we've had great conversations. Sorry.
I was going to say, we're in this cost of living crisis, right? We're rolling through it, coming out of from a pandemic with everything there to a cost of living crisis, people thinking about mortgages, car payments, you name it. What are you hearing from people when you go to these things?
Oh, people are just so glad to see us. The first thing they always say is, I didn't even know that you guys existed. or I wish I had known about you 20 years ago, or, my daughter could really use your help.
So
people
why
saying,
is that? If people, because when you show up and you're like, hi, I'm with the Credit Counseling Services of Newfoundland and Labrador, that's an interesting reaction to me for people to be like, oh my gosh, I'm so happy you're here. I didn't know you existed. And then what's the conversation you have with folks?
Yeah, so, a lot of people are wondering, what do we do from here? Like, where are we at? What does the next 5 years look like? My bank is telling me to access equity in my home, and I have a lot of debt, and I'm hearing on the radio every 2 seconds, different trustees are telling me I can go bankrupt. What are my options? What can I do? And at Credit Counseling Services, we go through people's finances with them from top to bottom and help them make those decisions, help them understand what each option actually is and what it means for them. And it's a free service. So many people don't know about that. They think, okay, well, I'll just go to my bank or talk to my mortgage advisor or my financial advisor. But credit counseling is free, unbiased advice.
Tell me something that might surprise folks. What's the range of people coming to you?
So it's all over the map, honestly. Our average client is about 45 years old.
That's
and
me.
I'm
45 years old.
Yeah. So every year we see the incomes are getting higher and higher because, it's not just a low economic status that needs help with finances. It's families with 2 jobs, 2 good incomes, 2 car payments, a big $400,000 mortgage. They need help too. They don't know what to do. So I think that might shock people, is the level of income that people have that do use our services, because a lot of people think it's, oh, I make too much money to use credit counseling, or, I own a home, I can't use credit counseling. And that's not the case.
No, if you're looking at what's coming in and what's going out, and you've got questions around it because you're in the red or about to be, and you're wondering about those bankruptcy ads, whether it's TV or radio or on one of the socials, you are the folks to talk to.
Definitely. We're here to help, and it's free.
How do people get in touch with you?
You can call us at 709-753-5812, or you can email us at info@ccsml.ca.
Lauren, thanks so much. I'll be in touch because we've got a show we're planning for next month, so I can't wait.
I can't wait. Thank you.
All right, bye.
And Adam, if I could, on that note, so Lauren will say, earlier we were talking about the silos and if they've been changing. So Lauren and I did a road trip up to the GMP last year with some other community partners as well. And I think the real key here, and that I take away from this partnership over the last year, is the relationship building and the working together that's been happening across systems and with stakeholders. And as we go across the province, we now have a new group of people and a contact list, et cetera. And so you wouldn't believe the amount of system navigation that I've been doing and connecting the dots and saying, hey, Adam, meet Lauren.
Yeah, exactly.
You know what I mean? And I think if we can make those official in some way, it's been a really great starting point, and really watching people work together, with this complex issue of well-being and creating changed health outcomes, that partnership and that collaboration really is the key for changing things.
You're listening to The Signal. I'm Adam Walsh. That was Lindsey Hynes, their Director of Community Vitality, Innovation, and Impact with the Community Sector Council. Also here with me in the studio, we've got Lynn Taylor, Assistant Deputy Minister, Wellbeing, Cabinet Secretariat, Dr. Pat Parfrey, CEO of Newfoundland and Labrador Health Services, and on the line, Darla King, Vice President, Transformation, in brackets, Wellbeing, at NL Health Services. The financial side, too. When we look at social determinants of health, when we talk about well-being, I wasn't even thinking about this up until this morning when Lauren was added to the show. Of course. But I think it really shows how complicated this discussion is. And I look at this show as it being the long game, right? We're not talking today, tomorrow. This is us talking about what's needed to change a culture of a province. So how do we know when we are making progress?
You go ahead.
Myself and Pat will argue for the answer here. I think that it's going to require some patience. I mean, this is as you say, this is the long game.
Not an election cycle, a long game, right?
Absolutely. And, maybe a really long game. Like we're talking a generation, 2 generations, whatever that saying is of, you plant the seeds for the trees of which you'll never see the leaves or whatever that saying is, right? But, you really do need to be thinking about what you're putting in place today and then how it will, take root and then build build over time. So, I mean, this is not something that we can expect to see, severe change in outcomes, next year. We are evaluating what we can evaluate and looking at, how progress is being made and the uptake of programs and the demand on programs and the expansion of programs. All of the evaluation is happening. But with respect to how it will change health outcomes, that's going to take a little bit of time.
I'm going to add to that now a little bit because it is complicated. Because life expectancy is probably one of the objective indicators that people would take. That takes a long time to change.
Yeah.
And then that's driven by cardiovascular and stroke deaths and by cancer deaths, which takes a long time to change as well. But there's the other side of the story, which is around our quality of our life and our sense of well-being and our sense of life satisfaction and our sense of belonging in communities. And we're at the top of the country for that particular outcome. We need to balance that against the objective indicators where we're at the bottom of the country. So the challenge for us is to use the good things that we have, which is community well-being, individual life satisfaction, in a way that allows us to be able to get change in those things that influence those long-term outcomes. And we've got a structure whereby we've identified metrics around the domains that influence life expectancy, around the social system and the environmental system and the educational system, etc. 7 domains that we have indicators that we can measure and give us a better sense of how well we're doing with our interventions over time.
So then, is that earlier at the beginning of the show? I mentioned that goal, right, for 2031. Is that all the stuff they're trying to look at for for the mission accomplished banner for 2031, or we're the healthiest province in the country?
Right. I mean, that's going to be complicated.
Yeah.
Because I can't visualize life expectancy changing that fast. If you want the truth.
Yeah.
I mean, even when you took the big things that happened as a consequence of the Framingham study and intervening in risk factors that predispose to cardiac disease, it took decades for that to have an effect. So if you're going to say it's only one indicator is life expectancy, it's going to be pretty difficult.
Yeah.
But if there are we've got to be more sophisticated in how we report progress, but we must report progress.
Yeah, and the goals are in place for on the nicer side of this and that number. Like, you have goals for a reason because you try to work towards them, even whether or not they're realistic or for how they get counted.
Right. I mean, I think that if our sub-metrics will be things like the child health benefit.
Yeah.
Where do we stand in Canada for the child health benefit? Are we reducing poverty amongst children? Biggest intervention that will help health outcomes that we can think of. But it'll take decades for the outcome to occur. But if the intervention has been successful, and we are in that area, we can say, yes, good. Or if the number of people who are food insecure coming to school is decreasing, that's really important.
Yeah.
Or if people who are excluded, like LGBT community or Indigenous people, and their health outcomes are improving based on different metrics, then we can say our inclusion endeavours are helping as well. So there's a bunch of sub-metrics, I suppose, that are very likely to be good surrogate markers for the eventual outcome of improving objective measures of health.
Yeah, and it's all massively meaningful for what you just said. Every bit of that, it's people and their well-being and how they see themselves and feel on the day-to-day. And if that gets improved, kids not hungry, kids, full bellies in school, LGBTQ plus community feeling like I belong here in a province, that is massively important.
Yes, I agree.
There's only 5 minutes left. Where's this all going now? What other work have you got planned? What can you tell me?
Well, I can tell you a little bit about maybe the next intervention that's coming up
Sure.
just around the corner, and that's Wellbeing Week 2025. So this is our 3rd annual Wellbeing Week. So it's taking place from September 21st to 27th. And what we're trying to do is just, give it as an opportunity for people to keep talking about this, keep talking about the components of well-being that are meaningful to them, encourage communities, municipalities, different groups, organizations, private business, whoever you are, to be thinking about, what you can do that week to improve awareness of well-being or take steps to maybe improve the well-being for yourself or people around you. So really looking forward to that week. Lots of engagement going to be happening around that week. Community sector organizations have really embraced this idea. So, big shout out to CSC and everything that they're doing to promote this throughout the province.
Darla King, what about yourself?
Yeah, well, I'll just bounce off the idea around Wellbeing Week. So I did want to mention that some of the other groups that are around the province that are helping to support these messages, like Dr. Parfrey said, it's the small things that are going to add up over time that are going to bring about these interventions. So I did want to mention our wellness coalitions. So we have 7 wellness coalitions across the island right now, and those are groups of people representing local businesses, local organizations, nonprofit, NLHS that come together on a regular basis to have discussion about this type of work. They have grants available that they will provide within the communities to help, sort of spark some of these smaller ideas that build over time. And then, a small project might become a bigger project that gets scaled up. I know this year the wellness coalitions are planning events locally for Wellbeing Week as well. So, I think it's just a time for us to recognize the people who are doing this work and doing it well in the communities, and, to really give them kudos for that and to help them build capacity so that the initiatives can get bigger and spread more easily as well.
Lindsey, where's your head right now for what work you're going to be doing? What's coming up? What can you talk about?
I never know what's coming.
I know.
That's the problem. I can't talk about it because I don't know. I just think that with Wellbeing Week around the corner, we have had a lot of engagement across the province from the charities and nonprofits. And I think if folks are thinking about getting involved, they haven't done an event before, communities know what works in their place. Yeah. So I don't think it's to overthink it, and I think if people can look around their community and design an accessible event for the folks that live and work and play there, there really could be anything as simple as a social event, because as we've talked about, loneliness is the hugest issue right now that we face, especially in Newfoundland and Labrador. So it's better to do something than to do nothing, and you don't need to wait for Wellbeing Week for that either.
Question: from the first one you did to the last one, any big learn? What was the?
That's a whole show.
What's something that you took from the beginning towards the end of bringing these around the province?
Co-creation is key. Every one of these has been different. Yeah. And it's because the community has been different, and the community people who put their trust in the community sector council and the partners to say, hey, I'll help you do this in my place. Yeah. It could never have been done without them.
Exactly. So it's not directive or instructive. It is hey, we're looking at this. Can we? And you build something.
We're trying to do this cool thing. Do you want to help me do this cool thing?
Yeah. Which, that kind of thing, I can see how people would be interested in that.
And then the trust spread through the community. So that's why I think one of many reasons as to why we have had good engagement is because the trust is there, and folks are genuinely willing and interested to come and attend and to take in all the information and then spread it out into their communities.
Dr. Parfrey, final thoughts. We only have about a minute left. On direction or the work or anything else around well-being and pushing things ahead.
So our objective was to increase awareness and take action on the social determinants of health. That was half of the health accord. We've done a pretty good job of increasing awareness. Now is the time to act. And if you look at children, we want to be able to identify children who are vulnerable to having bad outcomes and put wraparound services around them, whether it's social or medical. We want to have a better child health model in how we deal with children, again, whether it's social or medical. And when you look at seniors, you got the same issue there. We need to have better ways of being able to support the elderly at home, deal with frailty, improve our personal care home management and our long-term care facility management. That's a big challenge for our province as well. So my stress would be on, let's get the actions now.
All right, folks. Thanks so much for this conversation today. That is it for today's show. If you've got thoughts for me, The Signal at cbc.ca. You can call the Signal line and leave a message, 709-576-5260. Today's Monday, which is done and dusted. Tomorrow is, it's Tuesday, which means it's gardening day. Tim Walsh from the Munn Botanical Garden will be my guest for a July gardening check-in. You know, your raised beds are growing, but then what do you do? I mean, I need to know this too. That's tomorrow. Don't miss it. Cheers.